The information provided in this podcast is for educational purposes only and should not be taken as medical advice. Before making a health decision, please consult with a qualified medical professional. Thank you for your attention and enjoy today's episode. What is up, good people of the internet? My name is Tony, and you're tuned into Hemp Nerd, the podcast that clarifies how medical cannabis works so you can get reliable therapeutic results. Now, in today's particular episode, we're going to be looking at shingles, and the question we're going to be answering today is, does CBD oil work for shingles and shingles pain more specifically? Now, if you are a regular listener or viewer of this podcast, you know the first thing that we normally do first is understand the problem. So we're going to spend a bit of time just understanding exactly what shingles is, and then from there, we're going to transition into looking at whether cannabis treatment, cannabis therapy, including CBD oil, of course, because that is the most popular cannabis product or medical cannabis product available in the market at the moment. We're going to look at whether cannabis does actually work, is beneficial and effective for treating shingles and shingles pain. So with that said, let's get into today's episode. So to kick things off, the first thing we're going to do is answer the question, what is shingles? So I'm just going to be reading from my blog here at HempNerd.co. So shingles is a viral infection that causes a painful rash anywhere on your body. Shingles commonly appears as a blistering rash strip that wraps around either the right or left side of your upper body. Now, shingles is not considered a life-threatening condition, but it is characterized as being very painful. So obviously pain is the main symptom there that we'll be looking at treating with medical cannabis or cannabis therapy in general. So what causes shingles, right? So shingles is caused by a virus called varicella zoster or the varicella zoster virus. It's the same virus that actually causes the chickenpox, whether you know that or not. And if you've had chickenpox in the past, there is a strong likelihood that the virus is still dormant in your body. Now, the varicella zoster virus can remain dormant and symptomless for decades in your body. All right, just dormant, doing nothing, chilling, I guess waiting for the right opportunity to strike again. Now, when the virus reawakens or reactivates, it travels along your nerve fibers to your skin to cause the painful blistering rash we call shingles, which is obviously the highlight of today's conversation. The varicella zoster virus is also called herpes zoster, but is not the same virus that causes genital herpes. So two different things. Now, the first time someone is exposed to the varicella zoster virus is when it causes chickenpox. After your or someone else's chickenpox episode, the virus settles in your nerve cells and reactivates decades later as shingles, or it manifests later on as shingles. Anyone that has had chickenpox can get shingles, and the risk increases with age. So the older you get, the more likely, and this is obviously if you've had chickenpox in the past before, the older you get, the more likely it is that you're going to develop shingles in the past, according to the research I've done so far. So it is believed that people over the age of 60 are 10 times more likely to get shingles than younger people. Other factors other than age known to increase the risk of getting shingles include chronic stress, long-term trauma, a weakened immune system from conditions like HIV or cancer, or some cancer medicines and steroid medicines as well. So with that said, make sure you're looking after yourself and you're implementing things like exercise, meditation, people call it mindfulness, just to lower those stress levels so you don't actually reactivate your varicella zoster virus that's sitting dormant in your body if you've had chickenpox in the past. Now, shingles is contagious, but not in the traditional understanding of what a contagion is. So your shingles rash, for example, will not cause an outbreak of shingles in someone else. However, your shingles rash can most likely cause an outbreak of chickenpox in a child, because obviously a child has never had chickenpox before, most likely. In addition, people who've never had chickenpox or the chickenpox vaccine, for that matter, according to the medical community, can contract the virus from direct contact with open shingle sores. So if you've never had chickenpox or you've never had a chickenpox vaccine, and someone's got shingles, stay away. It's just common sense, stay away. Hence, if you have shingles, it's important to keep away from children, pregnant women, and people with weakened immune systems like chemotherapy patients, just as an example. Now, what are the symptoms of shingles? Now, according to the medical community, the early signs and symptoms of shingles manifest 1 to 5 days before the rash actually develops. All right. The early warning signals include itching, tingling, burning, and pain in the area where the rash is due to develop in the near future. After that 1 to 5 day period of the itchy and scratching. Other symptoms actually include a fever, chills, a headache, and an upset stomach. The most common location for the shingles rash outbreak is around one side of your waist, so kind of like a half belt, so to speak. And the second most common outbreak location is on the side of your forehead or around your eye. So again, maybe think of it like a half mask, or like I'm thinking of the Mike Tyson tattoo where it's like on one side of your face. So think of an outbreak, a rash outbreak in either one side of your waist or one side of your face. I'm sure you get the picture. Now, the shingles rash is a distinctive cluster of fluid-filled blisters. Not a pretty sight. Shingles blisters normally start to scab over in about 7 to 10 days. So I guess they'll start drying and scabbing then, and then they can completely disappear in 2 to 4 weeks. Now, shingles blisters leave no scars in healthy people, and the pain and itchiness goes away in a few weeks to a few months. However, if your immune system is weakened, your shingles blisters take a longer time to heal. Okay, which again is important for you to maintain a healthy immune system. Again, stress less, exercise more, eat healthy as well. Make sure you're eating clean. And obviously make sure you're looking after your immune system as well. Also considering the times that we're in, where the media is constantly pumping negative information regarding a specific other virus that we all know that's on top of mind for everyone at the moment. Now, the pain and itchiness caused by shingles can linger for months or years after the blistering rash has healed. The ongoing pain and itchiness is due to damaged nerves in the skin and beneath your skin. This is known as post-herpetic neuralgia. I think that's how you say it. This is known as post-herpetic neuralgia, PHN, and is described as a neuropathic pain syndrome that persists after a rash has healed. And this is where I believe where CBD oil and cannabis treatment actually comes into play, because we're looking at treating neuropathic pain, because that's what shingles has been characterized as, or maybe the pain associated with shingles has been characterized as neuropathic pain. So this is where people are looking at using cannabis treatment or cannabis therapy to actually alleviate that pain. In severe cases, ongoing pain and itchiness on the one rash affected area can lead to insomnia, depression, and weight loss. So again, there's additional benefits there with using cannabis treatment. Obviously, that can help with insomnia, especially if you go with an indica strain that will knock you out almost instantly. And then obviously with depression as well, that can help, because as long as you're not abusing, you're not a substance abuser when it comes to medical cannabis, it can help with depression. And there's going to be some research I'm going to go into in future episodes talking about the impact or the effectiveness of cannabis for depression. I'm just not there yet. And of course, with weight loss, you're gonna have the munchies. Like everyone, especially in the recreational community, knows that when you do consume cannabis, for medical reasons or not, you will experience a phenomenon called the munchies, and you just be eating more, you feel hungry more, and all that kind of good stuff. When the virus attacks the nerves that control facial sensations and movement, this is called ophthalmic shingles. When this happens, a blistering rash appears around one of your eyes and or on one side of your forehead. Ophthalmic shingles is normally accompanied with a headache with other symptoms including redness and swelling of your eye, inflammation of your cornea or iris, a drooping eyelid, and blurred or doubled vision. So it just messes with your vision and your sight. Now, according to the medical community, about 20% of people with shingles develop a rash across multiple dermatomes. Dermatomes are described as separate skin regions that are supplied by separate spinal nerves. When the virus affects 3+ dermatomes in form of the rash, it's called widespread zoster or disseminated zoster. In widespread zoster, the rash looks more like chickenpox than shingles, right? And it is more likely to occur in people with a weakened immune systems. Now, with all the research that I've done in regards to weakened immune systems, this is if you're someone who's battling cancer, going through chemotherapy, or you're battling HIV/AIDS. Like that's how weak, or that's the level of weakness that your immune system needs to be in order for you to contract widespread zoster. But that's not to say that you shouldn't look after yourself even if you don't have those conditions. It's always a good idea, again, to eat clean, train mean, and make sure you're working on your mind-spirit connection, whether that's through meditation, whether that's through prayer. Make sure you're having a lot of positive social interactions as well. And that's going to all contribute to boosting your immune system, because you're going to be having less cortisol being produced in your body. And less cortisol is good, especially in the times that we are in, because that means, your immune system is ready and able to actually fight anything that comes to challenge your body, any virus or bacteria. Now, what are the treatment options for shingles? According to the medical community, there is no cure for shingles. And this is, side note, this seems to be a common statement that I keep finding every time I research a condition. The medical community says there's no cure for X or Y condition. So that's what they're saying for shingles as well. Hopefully, in time, with the more sophisticated we become with medical cannabis, we can get to a point where we are actually curing diseases and we don't need to face these things anymore. But with the current establishment, I think they're more content and happy with not having a cure, which is ridiculous to me. Anyway, the medical professionals believe that quick diagnosis and early treatment with antiviral medication can stop the viral attack that is shingles. If your shingles is not stopped, doctors still believe antiviral medication can make your case shorter and milder, which basically means it helps soften the blow. And doctors generally prescribe patients with either Zovirax, Famvir, and Valtrex. Now, due to shingles causing severe pain, your doctor may also recommend capsaicin, a topical patch used to relieve pain, gabapentin, an anticonvulsant used to treat neuropathic pain, amitriptyline, a tricyclic antidepressant used to treat depressive and anxiety disorders, lidocaine, a numbing agent delivered via cream, gel, spray, or skin patch, codeine, an opiate used to treat pain, corticosteroids used to treat skin conditions. And looking at all those things, already my mind is going, cannabis treatment can look after, it definitely can look after pain, easy. And we're going to go into the research very soon. And it can definitely look after, if you make topical cannabis treatment, then I'm sure that can have a positive effect as well. In fact, my previous episode where there was a story of a lady who had multiple conditions, I was looking at gastroparesis, right? Her name is Joanne. And she had a bunch of other conditions, two of which was osteoarthritis and degenerative disc disorder. And she makes her own topical cannabis treatments, so like creams or oils that you apply on your body. And she said that helps with inflammation when that flares up. So who's to say that won't work for any skin pain that you might have? Let's say if it's around your face or around your waist, if it's actually causing flare-ups, inflammatory flare-ups, or just flare-ups in general, and it's causing pain, who's to say that won't work? Because I actually believe it will. Because if it can work for osteoarthritis, which is way more, I personally believe anyway, not from experience, just from personal belief and perspective or perception, the pain of osteoarthritis and degenerative disc disorder is, I believe, way more than the pain that you get from shingles. I could be wrong, and you're more than welcome to comment. If you're watching this on YouTube, you're more than welcome to comment below. If I'm mistaken, please let me know. But just based on my research, I think those two conditions would yield more pain than shingles. But regardless of which one yields more pain, at the end of the day, topical cannabis treatment has been shown already in those two conditions where pain is one of the major symptoms to actually relieve symptoms, including symptoms of inflammation. So if you're getting shingles pain on the side of your waist or around your face, who's to say that applying topical cannabis treatment won't alleviate the pain? Because it will. It definitely will. I personally believe that anyway. Now, medical professionals in the US recommend that healthy adults 50 years and above get a shingles vaccine. However, they warn not to get the vaccine if you have severe allergies to the ingredients and if you are pregnant or breastfeeding. Home remedies such as taking a cool bath or using a cool and wet compression on your blisters may help relieve pain and itching. Another recommended solution is to reduce stress in your life, as stress increases the risk of triggering shingles, which is what I've been saying in this episode. Reduce stress, eat clean, train mean, and make sure you maintain a strong mind-spirit connection. All right, that's what I personally like to call it anyway. Strong. That's why I meditate almost every day, and I pray almost every day as well in the morning before I get things going, and in the evening I meditate to wind down, so to speak. And that's me maintaining a strong mind-spirit connection, and that helps reduce the stress levels that I tend to experience on a day-to-day basis as an entrepreneur, because being an entrepreneur, especially in the medical cannabis space, is not an easy feat. You're constantly faced with challenges. So I need systems and mechanisms in my life to actually reduce the amount of stress that I may develop over time. Moving forward, actually, before I move forward, so I recommend you do something similar in your own life to, whether you're a shingles patient or not, whether you've had it or not, it's just good practice at the end of the day. It's good practice. The news is constantly pushing negativity. I don't watch the news, not as much anyway. Maybe I'll tune in for like 5 minutes, but I don't run to the news, because the news is just negative. It's constantly pumping negative stuff, and that's not what I'm trying to feed my mind. You are what you eat. So if I can stop letting my mind consume that, then I can stop putting myself in a negative state, which will then allow me to reduce my stress levels to the nth degree, and have a very strong enough immune system to fight any viruses or bugs that show up in my life, because I've got a young one who goes to kindy. So the kids, bacteria and viruses come home, get sick. I don't have to deal with any of that stuff. So hopefully you're picking up what I'm putting down. Now, the question of the day, all right, the question of the moment, why we're all here today. Does CBD oil work for shingles treatment, or does CBD oil work for shingles? So in my personal belief, and with all my research, I'll clearly just state right now, yes, CBD oil does work for treating shingles. More specifically, CBD oil will help treat any pain and inflammatory symptoms and any post-therapeutic neuralgia associated with shingles. Cannabis is scientifically proven as well to be effective for treating neuropathic pain, which is the pain that shingles is characterized as. And I'm going to now dive into the research that supports that statement. So how effective is CBD oil for treating shingles, and more specifically shingles pain? So to answer this question, we need to look at the results of a 2015 peer-reviewed journal, a 2009 peer-reviewed journal, a 2018 peer-reviewed journal, and a 2010 facial post-therapeutic, I think that's what you say, post-therapeutic neuralgia patient study. So those 4 pieces of research and data is going to help us, or should I say the results from those pieces of research and data, those journals, will help support the statement that I made that CBD oil and basically cannabis treatment in general will work for shingles and shingles pain. Now, in 2015, right, researchers set out to assess the effectiveness of cannabis treatment in the management of chronic non-malignant neuropathic pain. The researchers rated and reviewed 13 studies using the Jadad scale to measure the level of bias in pain research. The Jadad scale is a procedure used to independently assess the quality, or the methodological quality. Is it methodological or methodological? The quality, the methodological quality of a clinical trial. Upon evaluating the results, the researchers found that cannabis provides effective pain relief effects in chronic neuropathic pain conditions that were unyielding to other forms of treatment. So that basically means from those 13 studies that they looked at, and obviously they made sure that they were quality studies as well, and they evaluated the results. The researchers found that cannabis provides effective pain relief in chronic neuropathic pain. Remember, neuropathic pain is the type of pain that shingles is characterized as, and the conditions that they were looking at were, and I'm going to go through the list of neuropathic pain conditions, but basically the conditions were unyielding. They did not, they were unyielding to other forms of treatment. So they were treated with, let's say, everything else that we've mentioned prior, all those other creams and other stuff, corticosteroids and all that other stuff we spoke about earlier in regards to current shingles treatment. That stuff didn't work. Okay, it didn't provide any positive therapeutic or pain relief results for the patients prior to taking cannabis treatment in the studies that these researchers were reviewing. They concluded their review by stating that cannabis therapy provides effective pain relief effects in a large variety of neuropathic pain conditions. Examples of neuropathic pain conditions include, but are not limited to, diabetes, chronic alcoholism, limb amputation, herpes zoster infection, shingles, all right, spinal surgery, cancer and chemotherapy drugs, viral infections such as HIV/AIDS, multiple sclerosis, MS, and facial nerve problems. So that's again similar to shingles because it can also activate or attack one side of your face, and once the blisters and the rash, whatever you want to call it, goes away, your nerves can still be affected for a while. So with that, yeah, there's positive results there as well. Now, in 2009, a peer-reviewed journal defined neuropathic pain as a debilitating form of chronic pain resulting from nerve injury, disease states, or toxic insults. Neuropathic pain is often refractory to conventional pharmacotherapies, necessitating validation of pain relief medication that they don't normally use, that's not available in pharmacies, which is one that we're investigating at the moment in the name of cannabis treatment or cannabis therapy. So for neuropathic pain in general, what that statement is basically saying, the definition of that what that definition is saying is that neuropathic pain does not yield to conventional forms of treatment, does not yield to any pre-existing forms of pain relief medication that currently exist in our medical system, that's readily made available and that's provided to everyone, that's legal, so to speak. Neuropathic pain doesn't yield to any of those. So the researchers went and reviewed 183 clinical and preclinical studies to evaluate and validate the usefulness of cannabinoids for neuropathic pain management. In this review, neuropathic pain was associated with nerve injury, diabetes, chemotherapeutic treatment, human immunodeficiency virus, HIV, multiple sclerosis, MS, and herpes zoster infection, shingles, or chickenpox. That's what they associated neuropathic pain with, those conditions. And of course, our interest in this particular episode is the herpes zoster infection or herpes zoster virus, which is either shingles or chickenpox, more specifically shingles, right? The researchers reviewed the effects of smoked marijuana, synthetic THC, and cannabis-based medicines containing both THC and CBD in a 1-to-1 ratio. For example, sativix or Canador. Sativix has been mentioned in previous episodes of the Hemp Nerd podcast, and this was all in human neuropathic patients as well. So they did this within humans. This is not in rats or anything like that. Just so you can think, oh, was this just in rats or in mice, or is it human beings as well? They looked at studies pertaining to human beings only. Now, objective and subjective models of pain and quality of life measurements were both considered for the review, and the authors discovered that the research and data published in the various trials pointed to an overwhelming agreement that the neuropathic pain patients gained therapeutic benefits from cannabinoid treatment. So the researchers concluded that clinical studies largely affirm that neuropathic pain patients derive benefits from cannabinoid treatment. All right, I'll say that again. The researchers concluded that clinical studies largely affirm that neuropathic pain patients derive benefits from cannabinoid treatment. Again, shingles is classified or characterized as neuropathic pain. For the most part, it will not yield to current medication. However, with how many studies was that? 183 clinical and preclinical studies. The researchers concluded that cannabis treatment cannabis therapy is the exception to the norm in regards to neuropathic pain, because if you are a patient of shingles or you're suffering from shingles pain in some way, shape, or form, you are going to derive a benefit from actually using, according to this 2009, was it? Yes, according to this 2009 peer-reviewed journal where they looked at 183 studies, they said yes, you're going to derive a benefit from using medical cannabis treatment, whether you want to inhale it, whether you want to put drops under your tongue, whether you wanted to use it as a topical treatment on your body, you are going to derive a benefit from it. All right, moving on. In 2010, researchers set out to investigate whether topical therapy, so this one now applying on the skin, with a cannabinoid receptor agonist helps provide pain relief in patients with post-therapeutic neuralgia caused by herpes zoster, shingles, right? An agonist is any substance that initiates a physiological response when combined with a receptor in your body. Post-therapeutic neuralgia is a difficult to treat common negative effect in shingles patients. It affects your nerve fibers and skin, causing a burning pain that lasts long after your blistering rash has disappeared, which is what we spoke about earlier when we were understanding the problem. And this is why it's important for us to actually understand the problem before jumping into whether CBD oil can work or not, or cannabis therapy or cannabis treatment can work or not for your condition. Because if we don't understand the problem, we're most likely going to make more mistakes, and it will be difficult for us to gain any therapeutic success using cannabis therapy moving forward. All right, so if you do think that I do waste a bit of time at the beginning understanding the problem, or you think it's a tactic for me to gain more time on YouTube or whatever platform I am to get, it's not a tactic of the strategy. The clear cut strategy here is, let's understand the problem, and once we do that, we'll be able to understand clearly whether cannabis is going to work or not, as opposed to being extremely subjective. Let's be objective with our approach. Let's look at the problem objectively. Let's understand it objectively, and let's see whether cannabis will work objectively. All right. So I just thought I would get that off my chest. Moving forward. So the open labeled study tried only 8 patients, right? And this is where some doctors will say, oh, the sample size is too small. I get that, but we have data. Instead of complaining that the sample size is too small, why don't you step up and actually do the same test, or refine the experiment with a bigger sample size? Instead of saying, oh, it's too small, blah, 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 let's forget about it. No, we've got some data. All right, it might be a small sample size, but some data is better than no data. And if you're in the medical community and you're contesting or against these studies because the sample size is too small, well, step up and refine the experiment with a bigger sample size, and then let's look at the data that you collect. Because I don't want to hear that it doesn't work, and I don't want to hear that the sample size is too small, there's too little people, the quality of the experiments are not good. Come up, create a better experiment, publish it, let's find out the results. Rant over. So the open labeled study trialed 8 patients with post-therapeutic neuralgia caused by herpes zoster, aka shingles. They each received a cream containing a cannabinoid I can say this, but I'm gonna butcher it. N-palmitoyl ethanolamine. Forgive me. We'll call it PEA or P. Results from the study revealed that 5 out of the 8 patients saw an average pain reduction of 88%, because it's 87.8%. So an average pain reduction of 88%. The topical therapy was tolerated well by all patients, and no negative effects or unpleasant sensations were experienced. All right. So out of 8 patients, 5 patients reported that the pain relief or the pain reduced by 88%. That's a lot of pain relief. Look, I have no idea what neuropathic pain feels like. I have no idea what shingles pain feels like. But I have an idea of what pain feels like, and if there's something that I can take that will take away 88% of that pain, sign me up. With no side effects, all right? No negative side effects, no unpleasant sensations, all right? All positive, no negative. All right, and I'm just like to about 20%, 22%, just 22% pain from where I was before. I've gone from a 10 to a 2 in pain. Sign me up. No negative side effects, sign me up. That's why not? And if we, obviously if we can get a larger sample size and see if these results are consistent, why not? All right. Anyway, the study concluded that topical cannabinoid receptor agonists are an effective and well tolerated form of therapy or therapeutic option in post-therapeutic neuralgia. All right, very fancy words here in the medical community, I must say. These results suggest that cannabis therapy in topical form may provide pain relief effects, or will provide, not even may, but will provide pain relief effects in patients with post-therapeutic neuralgia caused by shingles. So this is the after effect after your shingles has gone, your nerves are still damaged. That's the way I see it. Your nerves are still damaged, so you're still firing. Pain is still firing. So if you take topical cannabinoid treatment, you're going to go basically based on that information. You're going to go from a 10 to a 2 in pain, and I'll take that any day over medication that doesn't actually work for my condition. In 2018, researchers set out to evaluate the usefulness of medical cannabis treatment for neuropathic pain. Remember, neuropathic pain is the type of pain that shingles is characterized as. The researchers examined the current scientific research and data from recent randomized controlled trials, RCTs. The studies reviewed had patients with a wide range of causes of neuropathic pain. The review included forms of cannabis therapy with varying cannabinoid concentrations and routes of administration. All right. Many of the RCTs reviewed demonstrated the effectiveness of medical cannabis with the number needed to treat and NT values in line with current pharmacotherapies. So obviously, to me, that sounds like the studies that they were reviewing kind of met a medical standard of a number needed to treat. Like they needed to treat a certain amount of people to then have valid data that they could look at and say, yeah, we can actually use this data. That's what that sounds like to me. I'm not in the medical field. I'm an outsider looking in, and that's what that looks like to me. Correct me if I'm wrong in the comments. According to the researchers, there is evidence that supports the safety and effectiveness of short-term, low-dose cannabis vaporization and oral mucosa delivery for the treatment of neuropathic pain. The results point to medical cannabis being as tolerable and effective as current neuropathic agents. Now, that statement there, that came from the study, but I personally believe cannabis treatment is more effective because from what we've read previously in this particular episode, what we've looked at previously, current treatment is doesn't yield positive doesn't yield any positive results for neuropathic pain treatment. So it's almost practically ineffective. Current medication in your pharmacy, if you're treating neuropathic pain specifically, is practically ineffective. All right, so you're not going to get any positive therapeutic results from them. However, this is going to 2018, and I guess they're just trying to cover their butts. They're not trying to be the medical professionals are not trying to be too enthusiastic about medical cannabis treatment. So they're saying the results point to medical cannabis being as tolerable and effective. I think it's more tolerable because you get less negative side effects. And when you say as effective as current neuropathic agents, I think it's more effective because so far, we looked at a study, I think 2 studies ago, 1 or 2 journals ago, we looked at patients, I think it was 2 journals ago, we looked at patients who did not get any, whose symptoms were unyielding to current treatment, but then when they took medical cannabis, the symptoms yielded, they got positive therapeutic results. So I think that statement is a bit too conservative by the journal, but at the end of the day, the results are the results. So the authors concluded that though their findings are mostly positive, further research is needed to determine long-term effects of medical cannabis use, optimize dosing requirements, cannabinoid ratios, alternate administration routes, and covering this information will help refine the therapeutic model of medical cannabis, which is why I'm in this game. This is why I'm doing this, because I align with that statement. Again, I believe that the authors of the journal were being a bit conservative and covering their butts, but I agree with the fact that they said that of course we need more research. We definitely need more research. Like we need to become sophisticated users of medical cannabis. We can't be here we can't be wishy-washy about this. We can't have a kindergarten mentality when it comes to using medical cannabis, because it has the potential, in my personal belief, in my view, it has the potential to what word am I looking for here? To replace most of the medicine we use, most of the pharmaceutical medicine that we use. It has the potential to replace all of them, because I personally believe that plant, that the cannabis plant, is a pharmacy in its entirety. Like I believe 99, maybe even 100%, but let's say for now 99% of all the conditions that we experience as a collective, as a human collective, can be treated with medical cannabis in some way, shape, or form. We need to understand which parts of the plants work best with which conditions, which variety of plants work with which conditions, what concentrations of cannabinoids which work best with which conditions, and what dosage levels we should be taking to treat which conditions. Like, there's a lot we need to uncover. There's a whole landscape that we need to uncover in regards to medical cannabis use and treatment. And the more honest we are with that work, I believe is going to move us. It's going to move us in the right direction as a collective. Instead of taking medications that give us more problems than solutions, I want you to take away this problem, but it's going to give you these 500 other problems. What's the point of taking something like that when you can take this one thing that's going to give you, it's going to take away your problem, and it's not going to give you any negatives. Maybe the negatives I hear about is sleep or tiredness or something like that. But other than that, like, it's well tolerated, and there are no negative side effects. I mean, it's never killed a person in human history. All right, so why is it illegal? We all know why, but that's not what we're talking about. Anyway, in closing, where do I land with all of this? Where do we land with all of this, right? Cannabis therapy, such as CBD oil, for example, is effective and useful for treatment of shingles, specifically in regards to providing pain relief and anti-inflammatory effects if you do get those. The studies and journals highlighted in today's article clearly show how effective cannabis therapy is for treating neuropathic pain symptoms brought on by shingles, or the herpes zoster or varicella zoster virus, all right, because that's essentially what it is. Moving forward, there should not be a doubt in your mind that you should be able to achieve effective treatment results from either CBD oil or medical cannabis in general for treating pain and any potential inflammation you may experience as well, but in this particular case for treating pain. In addition, you'll also be able to derive benefit from topical cannabis therapy to treat post-therapeutic neuralgia caused by shingles. All right, so that's any pain that lingers after the rash is gone, whether it's on your face or whether it's on your waist. You will be able to derive a benefit from topical treatments, so your creams, like body creams that have infused with cannabis. You'll be able to derive a benefit from that. We looked at a study or a journal that reviewed studies. I forget whether it's a journal or an actual study, but we looked at some data. We looked at some research and data that gave us the thumbs up. So your only challenge now lies in finding a suitable CBD oil solution that will assist you in getting results. This is where I kind of have to have a shameless plug, because I need to make a living doing this. All right. So what I've done with HempNerd, what I have now on HempNerd.co is what I call the CBD shops page. And with the CBD shops page, what I have there is a list of online retailers that actually sell CBD oil online, and they do either local shipping in the US and international shipping as well. So people like me in Australia can actually get access to their products. We have an affiliate partnership lined up. So when you click my link, and you purchase from their store, you're actually helping me as well. It's not going to cost you any more money than it would if you actually went there by yourself. But the difference between you clicking my link versus doing a Google search and going there by yourself is that the purchase that you make, a portion of that purchase actually supports HempNerd. It keeps us alive, it keeps the lights on, and it keeps me, bringing this information to you every week. And of course, it helps me put food on the table and all that good stuff. It helps me keep all the lights on. I think I've said that already. If you are in the market for CBD oil, just head over there. There's 4 companies that I'm working with at the moment. You can choose any one of them, any branding that appeals to you from one of those 4 companies. Purchase your CBD oil. You have the peace of mind that it is going to arrive. We have a criteria, and one of the items on our criteria is discreet shipping. So of course, international shipping, but discreet packaging, not discreet shipping, but discreet packaging. It most likely will not be seized by customs because of the discreet packaging, and then you can start to enjoy the benefits that is medical cannabis treatment, or what I personally now like to call cannabis therapy. All right. So head over to HempNerd.co/CBD shops. That's where you'll be able to find the links linking out to these 4 companies that I have at the moment. And over time, as I bring out more information and I reach out to more companies. I'm going to build out that list. You can also check out what our buying criteria is. There's like, I think 4 or 5 pieces to our buying criteria, but one of them is actually discreet packaging. The other one is international shipping as well, because there is an international demand for medical cannabis, for CBD oil, for cannabis therapy, because everyone is switching on to the fact that medical cannabis is the way to go. And you purchasing through my link helps support the service of me bringing this information out to you. So other than that, if you had any doubt in your mind that CBD oil is going to work, or cannabis therapy is going to work for treating your shingles pain or treating your shingles condition, again, you can watch this again, or you can actually go to HempNerd.co and read the blog, Does CBD Oil Work for Shingles and Shingles Pain? That's where you're going to have all the links if you want to nerd out on all the research that I looked into, all the data, the journals and the studies that I looked at to bring this information to you. You can go there as well and look at the information for yourself. You can read the blog post. You can listen to this in audio format as well, or you can watch the video again if you want to see my face. I don't know why, but hey. And yeah, you can basically reaffirm to yourself that you're actually going to derive a positive therapeutic benefit. I always highly recommend that you do work with a pro-cannabis medical professional, but those seem to be few and far apart. So for the meantime, it's best to do your own homework. I'm doing some of the homework for you, but you can go review the homework that I've done. Correct me where I'm wrong in any way, shape, or form. I'm always happy to make corrections, because this is a collective effort. I'm not superhuman in the sense that I can do this all by myself. But other than that, thank you for tuning in today. I really appreciate your time. Go ahead and buy yourself some CBD oil if you are dealing with shingles. Hopefully this episode strengthened your belief that it's going to work for you, and hopefully as well, if you're watching till this point, that I've also earned your subscription, and I'll know obviously by you hitting that subscribe button. But if not, I'll catch you in the next episode, where again I'll bring you more information regarding clarifying how medical cannabis works in our body for a specific condition, and hopefully then I'll be able to earn your subscription. But if I have, let me know. Take care, God bless, and I'll catch you in the next episode. Peace.